A lot of people are cutting gluten out of their diets, but do they really need to? Dr. Ramo explains who should be avoiding gluten and what that includes on the Healthbeat.
Gluten, everybody's worried about it. A lot of people have a disease called celiac disease, but most people just have gluten sensitivity. What is it? Dr. Hala Toubbeh, tell us about it.
There are a variety of severities of patients coming in with gluten sensitivity. Some have the full-blown disorder, and some simply are sensitive to gluten in their diet.
Now, a lot of people think that being tired or achy muscle or depression, a lot of things are attributed, besides the fact that they get GI problems. What do you think about that?
That's absolutely correct. And for those patients, we want to specifically test them using blood markers and possibly an upper endoscopy, test in which we obtain a small sample of the small intestine.
But that can cause those symptoms with fatigue and depression along with the GI symptoms.
It can in a certain number of cases.
Now, what if you test negative? Does it still make sense sometimes to go on a gluten-free diet?
It does. Not everyone who is gluten sensitive is positive for the blood test.
So if they have the problem of depression, should they go on a gluten-free diet, or is that stretching it?
If a patient feels that their depression may be related to gluten sensitivity, I encourage them to try it for 60 to 90 days.
Okay, well, that's really helpful. So if you have a problem and you're concerned about gluten, one thing is to go on the diet free of gluten for a period of time and see if you're feeling better. You can learn more about this on our website at KOAT.com.